Dominican Republic has it all. Dominican Republic has it all.
Welcome, and thank you for joining us in the Dominican Republic COVID-19 Preparedness and Response webinar hosted by the Ministry of Tourism of the Dominican Republic, MITUR, and the Association of Hotels and Tourism of the Dominican Republic, Asonahores. The webinar will be conducted in English, so at this time, before we go any further, allow me to welcome and give instructions in Spanish about how to turn on simultaneous interpretation for those of you who are Spanish speakers. Bienvenidos al webinar de preparación de COVID-19 de la República Dominicana, auspiciado por el Ministerio de Turismo de la República Dominicana, MITUR, y por la Asociación de Hoteles y Turismo de República Dominicana, Asonahores. El webinar se realizará en inglés y estamos ofreciendo interpretación simultánea al español. Para activarla, por favor, haga clic en el botón que dice Interpretación en la parte inferior derecha de su pantalla. Very well. Now, without further ado, the Minister of Tourism, Francisco Javier Garcia, extends his warmest welcome to all industry members who made time in their busy agendas to learn about how the Dominican Republic is COVID-19 prepared to safely welcome back travelers, as well as what measures were successfully implemented to prevent a massive spread of COVID-19 in the country, and how our medical facilities are ready to safely assist visitors and locals if required. We would like to thank members of Asonahores, and especially the President of the Hotel Association, Mrs. Paola Rainieri, for participating and for providing all her support to coordinate this event. We also acknowledge the support of Magali Toribio, Marketing Advisor to the Ministry of Tourism, as well as Andrés Marrancini, Executive VP of Asonahores, and Simón Suárez, current Director and President of Asonahores, for their hard work in the coordination of this presentation. Other participating institutions today include the Presidential COVID-19 Committee, the Mayo Clinic, the World Travel and Tourism Council, and the Santo Domingo Health Cluster. Welcome, everyone. Before we go to our first presenter, let me tell you that our panelists will be answering questions at the end of the presentations. So if you would like to send us questions, you can do it at any time using the Q&A button located at the bottom of your screen. Now, let me introduce our main speaker, Dr. Amado Baez. Dr. Baez is Professor and Vice President of the Medical College of Georgia. He is Public Health Advisor to the President of Dominican Republic and CEO of the Presidential COVID-19 Committee. Dr. Baez is specialized in emergency medicine, critical care, global health, and healthcare management. In 1999, he completed his residency in emergency medicine at the Mayo Clinic and fellowships in trauma critical care at Harvard University Brigham and Women's Hospital. He holds 2 master's degrees from the New York Medical College in public health and healthcare management and policy. Dr. Baez is an influential emergency care leader, and he has fellow status with the American Academy of Emergency Medicine and the American College of Critical Care Medicine, among others. His academic work has led to important accolades. He was born and raised in the Dominican Republic and has faculty appointments with the Harvard School of Public Health, the University of Barcelona, and the Universidad Nacional Pedro Enriquez Urena in Santo Domingo. He is also the founding president of the Santo Domingo Health Cluster, focused on medical tourism with social responsibility. Dr. Baez, welcome. The floor is yours.
Hello, and thank you for the opportunity.
Okay, Dr. Baez, the floor is yours.
Okay, can you hear me now?
Yes, we can hear you.
Okay, wonderful. And wonderful. So thank you so much for the opportunity. Clearly, it is an amazing privilege to be here in front of so many distinguished guests, and to be able to speak about my country, and to be able to speak about probably the most important honor I have been given as a professional, which is to lead COVID efforts, the greatest public health challenge in our lifetimes, and to be able to do this in the country that saw my birth. So Dominican Republic has a lot of history, and I wanted to share a little bit of that with the audience. We actually have the first city in the Americas, and as part of that, we have the first cathedral, the first university, and in fact, we actually have the ruins of what was once the first hospital on this hemisphere, Hospital San Nicolás de Bari, founded in the 1500s. So part of the history that Dominicans have, we have very notable historical landmarks and a wealth of history. A lot of people know the Dominican because of the beach and sand, but we have metropolitan cities like Santo Domingo and Santiago. We have a lot of history. So clearly, and a population of 10.4 million. So clearly addressing the challenge of COVID in a country as vast as Dominican, with so much culture, so much history, but a challenge with regards to some population concentrations, such as Santo Domingo and Santiago, was an amazing opportunity. So what I wanted to do was give you a little bit of a framework of how we started, how the Committee for COVID Care, Preparedness and Response started. So can we go to the next slide, please? So late March, the President of the Dominican Republic, President Danilo Medina, approached me and asked about how I could participate in the preparedness and response efforts for COVID. Back in March, I was already 3 months into the preparedness and response efforts in my home in Augusta, Georgia, as part of the Augusta University Medical College of Georgia response. I was already experienced implementing community efforts, emergency care efforts, and in fact, I was developing the ICU efforts for the university health system. One of the things that I think it's important to note is that nobody before 2020 was an expert in COVID-19. We all learn, and we all have been learning from COVID as we go. So for me, one of the main things to address is that COVID, you need to approach it from a management perspective with humility and with an open mind. And I think the testament to that is a lot of the things that we have seen with important global public health organizations and governments, and a lot of it has provided us with important lessons learned. So after I spoke about the opportunities, the amazing opportunity of working in the Dominican and helping in the COVID efforts, we were able to present the President a plan. So can we go to the next slide, please? I'm a simple-minded emergency physician. I joke that we use It's all about ABCs and 1, 2, 3s. And my traditional gap analysis effort is this STP, Situation Target Path framework. The situation is that COVID-19 is a pandemic. The Dominican Republic was experiencing important incidents, mortality, and capacity challenges and opportunities. The target was to develop important strategies, policy, and tactics that were integrated, all aligned with the Ministry of Public Health efforts to improve public health metrics, save lives, and achieving that by flattening the curve and increasing care capacity. On the path, we developed these 5 elements. Implement what we called a crisis public value model, to develop public-private partnerships, to develop and optimize technology solutions, to enhance and increase COVID testing as the pillar of proper epidemiology, surveillance, and pulse, and to look at economy and public health integrations. Can we go to the next, please? So we created a roadmap, one of the first tasks was to develop the first epidemiology intelligence fusion center in the Dominican. Another element was to create and implement, pilot for the first time, this crisis public value model, and we'll talk a little bit about that further on. We wanted to increase testing capacity, we wanted to leverage and integrate technology solutions, and we wanted to look ahead and understand economic principles integrated with public health and epidemiology principles. Can we go to the next, please? So one of the things that we started by doing was everybody was talking about flattening the curve. So one of the things that we wanted to address was to create an awareness of what flattening the curve really meant. Clearly, it's a concept that integrates public health aspects, prevention aspects, epidemiology aspects with hospital healthcare system capacity elements. In essence, we flattened the curve to decrease the effective number of individuals that have COVID at any given time. And by doing that, we are able to maintain the number of individuals who have COVID, including those that need hospital care and critical care. We are able to contain those individuals within the framework of the capacity of the healthcare system. So one of the things that immediately we understood is that for you to be successful at public health management with COVID, you needed to do 2 things in parallel. Us emergency physicians, they joke about us having an attention deficit disorder. We call it multitasking. We like to multitask, task management, do things in parallel and not sequential. So we understood that the 2 parallel things that we needed to do was to address flattening the curve, so decreasing the number of COVID positive patients at any given time, and at the same time provide capacity building efforts, increasing capacity. Especially from lessons learned from China, South Korea, Italy, and Spain, critical care services was an important, very important item to address. For me, I am an intensivist. I'm a Harvard-trained intensivist, but I work primarily in emergency medicine. But for the past 10 years, I have been serving on multiple task forces that address pandemic preparedness and disaster ICU care, especially those efforts from the Society for Critical Care Medicine and the American College of Chest Physicians. So I understood some of the things that needed to be done, and we'll talk a little bit about that, because we learned the hard way after the Haiti earthquake about some of those lessons learned in optimizing critical care capacity. One of the things that it's worth addressing also is that for you to flatten the curve and for you to optimize care in a pandemic situation, you need to create that balance of what's right from an epidemiology and public health perspective with what's right from an economic perspective with what's right from a civil rights perspective. A lot of times there's this narrative of what is right for public health is wrong for the economy. We actually feel that that is not a fair statement. It creates this dichotomy of two very essential elements in any nation. And one of the things that we realize is that COVID patients need a healthy body. Primarily, COVID affects the lungs, but we know that it affects the blood system, the heart, a lot of organs like kidney and liver also can suffer from the inflammatory response, the consequences of COVID. So the body has vital organs like the heart, the lungs, the brain, and a nation also has vital organs or vital items that need to be perfused and taken care of. And public health is clearly one, but the economy, society are elements that also need to be addressed when one is managing a pandemic situation. So clearly we needed to talk about public health, epidemiology, and the economy and civil rights at the same time in parallel. Can we go to the next? And this is something that we did. This is an effort that addressed the economy and public health from a modeling perspective. This is work that was done at the Ministry of Economy, but I think it highlights very effectively what we did. If we had not implemented the many systems and policies and strategies as a government, not just my committee, but primarily the Ministry of Public Health, the Emergency Operations Center, the Ministry of Defense, the Ministry of Economy, a joint national effort holding hands together fighting for the same goals. If we had not done this effectively, you see that on the second week of May, we would have achieved a meaningful acceleration of cases that would have surpassed the system capacity, and that would have created a major problem like we had seen in other countries, like the US, like Italy, like Spain. So a lot of the policy efforts, a lot of the tactics, a lot of the strategies actually created a meaningful flattening of the curve, as indicated by our effective reproduction numbers, by our case fatality ratios, by our incidence. And this is what's highlighted in this curve. Red is what could have happened. Blue is actually what happened. We were able to flatten, distribute those cases over time, and effectively shelter the cases within the framework of an effective health system. The health system never achieved above a 50% capacity. So that is actually one other good metric of a proper response. Can we go to the next, please? So let's talk a little bit about some of those proposals that we presented April 5th at the Presidential Palace, the President and the Cabinet. And we'll start with the Epidemiology Fusion Center and Intelligence. Can we go to the next? So one of the things that we realize is that for you to properly manage a public health crisis, you need data. In 2020, you need the right data. You not only need data, you need multiple data efforts. You need to consolidate dashboards and data sources and inputs, create predictive models, and all of this integrated in a cohesive way. Lucky for us, we actually had a guru in technology and global health threats, Mr. Rainier Mayol, celebrated by MIT, a graduate of Singularity University, who was actually working on COVID technology solutions in Malaysia. And he is the director for technology for the Ministry of Economy in the Dominican Republic. And he is currently our director of technology for the COVID committee. So we had meaningful conversations while Rainier was in Malaysia at 12 midnight, at 5 a.m. My wife can tell you about some of those strange conversations at midnight and 5 a.m. so I could capitalize on having Rainier in Malaysia and pick his brain even before he arrived in Dominican. And this is a picture of what he was doing in Malaysia, a little bit of a picture of some of the things that we had in Dominican. Can we go to the next? And one of the things that we did is that at the request of the president, we visited the Ministry of Defense. And we realized that the Ministry of Defense had this huge multi-million-dollar facility called the C5I, Command, Control, Cybersecurity, Intelligence Center. And C5I had not been inaugurated. So we met with the Minister of Defense, General Paulino Sem. He gave us a tour of the facility. We met with the director, Contralmirante Lee Ballester, and we realized that this was the perfect home for our technology proposal. The creation of an intelligence fusion center. An intelligence fusion center that integrated the Ministry of Health, the National Health Service, foreign organizations like the CDC, PAHO, and also a very important thing to note, integrating intelligence analysis solutions like the military has. So not just reporting data, but actually producing intelligence products that could be translated into operational guidebooks. And this is what we achieved. We integrated about 12 different technology platforms. We integrated the reporting of the COVID tests with predictive analytics, with web service platforms. We integrated that with capacity assessment dashboards for the whole country. And by doing this, we created a meaningful platform that allowed us to create epi-intelligence products that could be used for strategies and operational success. By the way, we did all of this in less than 10 days. Can we go to the next? So this is the inauguration of the C5I. The C5I was specifically inaugurated to support COVID response. This is a picture of the video wall with all the different integrated dashboards. And we'll talk a little bit about some of the work that we have done since with the C5I. Can we go to the next? So for example, on the left is the news of the launching of the C5I and our COVID Intelligence Fusion Center. But on the right, we actually have an interesting tableau graph that integrates the McKinsey economic framework with what we call the COVID preparedness framework per province. So we were able to integrate data for provinces within the framework of the right category from an economic opening perspective. So now we have a public health tool, epidemiology tool that gets integrated with an economic assessment tool, and now we have a hybrid of different data inputs that allows us to understand in a very objective way the opportunities to further strategies from a policy standpoint as it relates to economic opening, what we call the desescalada. Can we go to the next? So by having the right data, now we can actually visualize the data the right way, communicate the data the right way, and analyze the data the right way. Here we have on the lower right, you have the very worrisome data of increasing numbers. Basically, one of the things we realize is that if you don't communicate data the right way, people are going to see things the wrong way. In a pandemic, you are always going to have numbers that are going to increase until the pandemic is over. The number of positive cases are going to accumulate, and it's going to look like it's growing further up, the number of deaths. But this is all relative to time, it's all relative to efforts, it's even relative to the number of tests that you do. If you, in the approach of testing, if you only test sick patients, you're going to have a pre-selection bias, and your case fatality ratio is going to be artificially high because you're not doing community testing. So we realized this really early on, and we started deploying different methods of providing community tests, whether it was with rapid tests or PCR tests, integrated with home visit teams. So a lot of different strategies to actually objectively address the case fatality ratios and the number of positive cases. And you see that overall, the trend is a downward trend. Can we go to the next? All right,
Dr. Baez, if you bear with us for a second, we seem to be having a technical problem.
No, no worries. I can talk, and then maybe I can do a little interpretive dance if need be. So one of the things that data gives us is a good objective view of what's going on. And I'm going to show you a couple of things that we learned. We learned that by doing community testing, we actually have a more objective assessment, a more objective pulse of what's going on from an epidemiology standpoint. We also learned that you can democratize testing. For example, with the economic opening, a lot of companies wanted to include testing in their protocols to make sure that their employees were safe. So by including tests in the protocols for companies, then you basically essentially allow the those tests to be integrated within your web service, your web platform, and you effectively have a more fine pulse on what's going on locally. And that is one of the other things that we learned. I'm going to show you on some of the other slides that everything that we do focuses on general doable strategies, but the implementation of the strategies needs to happen at the local level. So everything we do in terms of understanding the epidemiology needs to happen at the local level. Interventions need to happen at the local level, because the COVID behavior is influenced by a lot of different aspects. The specifics of the viral strain, the specifics of the society and behavior, culture, population density, healthcare system resources, and we'll use a case study of Provincia Duarte and Plan Duarte to highlight some of these opportunities. Later on the talk, so we're going to give you the example of what Plan Duarte was for us. It was the pilot of our public value in crisis, or crisis public value model. And we'll talk about some of those lessons learned, and then some of the things that we decided to implement, where Plan Duarte and a lot of our operational efforts were mostly reactive. We decided to implement a plan that was mostly proactive with Altagracia and Punta Cana. So we'll talk a little bit about that specific plan and how it became the next big plan that we were planning on implement. For instructions on the talk. The other thing, if you look at the roadmap, some of the other things that we talked about was including technology efforts, and we'll talk about the app that we developed and the contact tracing app that we're launching this week. Perfect. So here we have a slide. Let's go one back. All right, there we go. So we have the weekly trend in terms of positives and tested, and you see that every day we have increased the number of tests in a meaningful way. You can see that when we started, we were doing less than 2,000 tests per week. Now we're achieving more than 14,000. Yesterday we reported 2,500 tests. So this is something worth stopping and understanding. If you look at absolute numbers, if you do 2,000 tests and you get 500 positives, technically that is a 25% positive rate. If you do 400, that's a 20%. If you do 1,000 and you get 250 positives, relatively, that is still 25%. But in an absolute way, it almost looks like you doubled the number of positives. You went from 250 to 500. And I think this is worth explaining, right? The more tests you do, the more you capture positive COVID patients. So it is important to understand that when you increase the number of tests, you are going to pick up a greater number of positive patients. But one of the things that we realized is that by doing all these efforts in a comprehensive way, the relative proportion of positive tests was stable and decreasing effectively. And this is what this graph shows. Can we go to the next? Here we have a graph that looks at the 50 provinces that we have under direct surveillance and a day-to-day variation. So the number of tests done, if it's increasing, if it's decreasing, if it's stable. I should note that a lot of the number of tests is relative to whether we did an operation on that province the days before, because part of our operational efforts, we provide this bolus of tests to actually have a more community understanding, zero prevalence of the disease, and a lot of this variation has to do with very pointed efforts that we have done at the provincial level. Can we go to the next? Here we have this graph, actually today is 2.7. This graph just shows the combination of two things. Proper public health efforts to decrease mortality. So we have a decreasing case fatality rate to 2.7 today. But this also highlights that when you do the right thing by doing COVID testing in the community, you effectively change the numerator and denominator, and you actually reduce case fatality rate in terms of numbers just by including a better community understanding of the disease. And that's the combination of efforts that you achieve by doing more tests and by doing the right interventions to decrease mortality and morbidity. Can we go to the next? Here, this is one of those curves that people get afraid of. COVID cases in DR. This graph on the left is always going to increase because you start with 0, and the more cases you have, the more it's going to go up. It's never going to go down. That graph is designed to never go down. But if somebody sees the graph, they see, oh, the cases are increasing every day. The cases will always increase every day by design with that graph. So when we look at data visualization, I prefer to use the one on the right. So the one on the right integrates an overlap of recovered cases in green, active cases in yellow, and deaths in orange. So you see that our proportion of recovered cases is much greater than the number of active cases. And that means we are effectively reducing the reproduction number and controlling the disease. So it's a better indicator of what is being done. That same graph, it actually looks much, much better at the provincial level, not at the national level. So can we go to the next? So we'll talk a little bit about this crisis public model and what it is. This is a concept developed by Dr. Moore from the Harvard Kennedy School. And it's in essence a model that integrates services, results, and population trust. And to us, that was the secret sauce behind our operational success, a public health crisis model. Can we go to the next? This is the public value chain. You have inputs, you have organizational production, you have outputs that should provide results with encounters from the population, have social outcomes, and the outcomes themselves are the ones who should generate that trust. So lessons learned from this crisis public value model. 1, public-private partnerships work. 2, you need to design these models, but you need to act local. You need to implement it locally with local leadership. You need to integrate social, religious, and press leaders. You need to follow the evidence, so test. You need to do testing and understand the epidemiology in different clusters, different barrios, different locations. You need to innovate, and by innovation, I don't necessarily mean just technology. For example, we innovated by the deployment of home health, home visit units that go to the houses and provide COVID care and non-COVID care. So in this process of innovating, we realized that we had an interesting new model for providing primary care. And the model integrated teleconference and home visits. So here what we realized is that if you stabilize chronic diseases like diabetes, hypertension, COPD, these patients do much better when they have their chronic illness stable when they get COVID. So COVID, this is one of the things that COVID did. COVID highlighted system deficiencies and opportunities. Dominican Republic implemented a health system reform in 2007, 13 years later, primary care has not been implemented yet. And I could argue that if we had a strong primary care system, the response would have been even better. But we realized that there was an opportunity to create a solution to the public health and primary care opportunities by deploying technology and innovation such as home visits and teleconference. The other thing is listen. The consults that we did with social, religious, and press leaders, we actually did Zoom, or we still do. We do Zoom conferences, community conferences in every province on a weekly basis to understand the impact of our interventions and opportunities to continue. Can we go to the next? And this is Plan Duarte. On the left is a Zoom with the social leaders where we are talking about what to do. Then we have appointed social distanced meetings, on-site, boots on the ground in San Francisco, the capital of Provincia Duarte. We have strategy meetings where we roll out the actual operational plan, and then we have the actual implementation of the operation of what we call Plan Duarte. The reason why we chose Provincia Duarte had the highest incidence of COVID and the highest mortality in the country in early April. So we realized that rolling out the crisis public value model would have had a meaningful impact in Provincia Duarte and the country, because the country as a whole needed to have containment in Duarte. Can we go to the next? And this is what can we go to the next slide? And this is what the data showed. We intervened Provincia Duarte with public health efforts, with military, with public-private partnerships. And you have in early April, you see an increasing epidemiology curve showcased by that yellow-orange graph on top. Then we achieved a plateau. And now on the lower graph, you see how Provincia Duarte, in less than, I would say, 6 weeks, is rapidly becoming likely the first province in the Dominican to be COVID-free. A true success story. In 3 weeks after we intervened with Plan Duarte, the ICUs in Provincia Duarte and San Francisco were not seeing any COVID patients. Today, about 6 weeks later, the epidemiology has done a 180. And it's a very different environment. So this proved to us that the public value, the crisis public value with the public-private partnerships, with the integration of community leaders and local government, that model worked. Can we go to the next? So we looked at implementing that in other provinces, in Santiago and Puerto Plata. And one of the things they wanted to do is actually prove that by intervening in Provincia Duarte as the highest incidence mortality province in the country, by intervening just there, we were able to achieve a meaningful impact. And we did this study 3 weeks before Plan Duarte, 3 weeks later, and there's a statistical significance with regards to mortality and incidence in the country. So by targeting an intervention locally at the province that manifested the highest numbers, we were able to change the epidemiology evolution in the country in less than after 10 days of intervening, and sustainable many weeks later. Can we go to the next? This is the assessment that we realized was important to have, is that we can provide national data, but the reality is that all the interventions and all the epidemiologic assessments need to happen at the local level. So we have been following provincial data more so because all the interventions happen at the local level. And this graph shows 15 of the provinces we have under direct surveillance, and it shows that 11 out of the 15 actually have achieved a plateau or a deceleration in terms of epidemiology. That was a very different story 8 weeks ago. Can we go to the next? This is just more data showing the same plateau, decels, recovery numbers in green. So in essence, we are getting more recovered patients than active patients throughout the country, and even more so in provinces that we have intervened. Can we go to the next? From a capacity, remember we talked about that epidemiology curve, flattening the curve. A lot of it is about prevention and decreasing the reproduction numbers. But we also needed to look at hospital capacity augmentation. The framework that we use with the Society for Critical Care Medicine is S4, staff, stuff, space, and systems. Can we go to the next? So one of the things we realized is that we needed to optimize critical care services. That was somewhat of the Achilles heel of this pandemic, because critical care services in developed countries were hit hard. In developing countries with a different socioeconomic status like Dominican, we needed to strengthen critical care services. And this is what we achieved with this workforce multiplication model, where we basically said, well, we have good specialists. And again, we live in an island. But we have an island of 10.5 million individuals. We have specialists from the best medical centers in the world, Europe, the States, South America. They are here in the Dominican. And like any country, we have underserved areas. And the idea is that how can we leverage the expertise that we have with technologies and actually able to have a force multiplication model throughout the country. Can we go to the next? So one of the things that we did was that we created this training program. 12 different ICU specialists from Latin America, helping us during a one-week training effort in the COVID critical care principles, integrated with our Society for Critical Care Pulmonary, the Society for Critical Care Medicine, the International Society, and our National Health Service and the Ministry of Public Health. In a week, we were able to train greater than 2,500 providers. That on itself is a fantastic reflection of how COVID changed the landscape of education and work. People became more in tune and more open about teleeducation. All of this was done online. Specialists from Mexico, Puerto Rico, El Salvador, Colombia, training Dominican providers online on principles of COVID critical care. So now we have a cohort of non-ICU providers trained in ICU principles. Next, the next logical step is for us to leverage technology and start working on a tele-ICU project. We have approached the US Embassy, the Israeli Embassy. We have a framework created with the National Health Service and 3 professional societies. And we're going to start with 2 hospital hubs in Santo Domingo, providing tele-ICU care to 3 remote underserved sites in the Dominican Republic. Again, technology being leveraged to effectively fight COVID. Can we go to the next? We also created, they say that nobody's a prophet in their own land. So one of the things that we did, we created an international board of advisors with friends from Harvard, University of Maryland, George Washington, the University of Barcelona, and several Latin American experts. And then we integrated Dominican professional societies, and we have video conferences and meetings with them recurrently to talk about different updating protocols and integrating technology and such. And a lot of this favors a nice, transparent transfer of knowledge framework. Can we go to the next? So when we talk about economic and public health synergies, that was also part of the task. Next. The idea was to start looking at intelligent social distancing and our reopening phases that started about 2.5 weeks ago. Can we go to the next? And the idea was basically how to best integrate epidemiology principles with economic principles. And we found that a lot of different prediction models integrated the effective reproduction number, that RT, and then by integrating the RT, we actually had a very objective way of assessing impact and opportunities with regards to economic opening. And this was done, this was work done directly by the Ministry of Economy and the Minister Juan Ariel Jimenez. Next. So the idea was to look at this RT and look at improvements in the RT and guide the economic opening phases based on the epidemiology landscape. We used that McKinsey framework. We used different epidemiology and economic models that integrated Bayesian modeling like Sistron, SIR, and basically determined when was the right time to actually look at economic opening in phase 1. Right now we're in phase 2 of the economic opening and constantly monitoring the epidemiology impact of economic opening. Can we go to the next? Again, epidemiology numbers integrated with capacity numbers all throughout, always. We have a hospital system dashboard that integrates public and private systems. And this is just a print screen from yesterday, where the ICU occupancy rate is at 42%. And we have it at the provincial level because every province has different healthcare resources, and we monitor that twice a day. Next. And this was all work done possibly because of the Intelligence Fusion Center. So this, we fast forward from April 5th to this past weekend. We realized that part of economic conversations in the Dominican need to necessarily include tourism. We understand that tourism is important. We even understand that tourism is important as a wellness component. People, the whole world is suffering COVID, and people need a break. But people that want to take a break need a break where they feel safe. So last weekend, we started the Punta Cana Safe Zone Plan. This is a comprehensive public value model with public-private partnerships, with a public health system, private health system, police. It has pillars that include security, public health, tourism, communications, social leaders. And in essence, this is the proactive version of our Plan Duarte. This is the long-term prevention safety effort that integrates this public value model. Can we go to the next? I'm just going to showcase a lot of the reasoning behind the strategies and operations for this Punta Cana Safe Zone. We use the dashboard, and I'm going to tell a story by Twitter. So we use the Intelligence Fusion Center to understand the granularity of epidemiology of numbers, both at the Punta Cana touristic area and at the province of Altagracia, where Punta Cana is. So we understand the system capacity, the epidemiology numbers. We later go on to a planning phase using public health and military assets. Military assets mostly because the Epidemiology Fusion Center is housed out of the Ministry of Defense. But we integrate the public-private partnerships. We create a model. We visit the different communities in the area. We look at not just the wealthy, but the underserved in terms of all the different community items. And we produce that intervention. We produced that intervention with hundreds of COVID tests deployed last weekend to obtain a fine pulse, epidemiology pulse. That created an understanding of very pointed opportunities in the region and helped us shape up a pretty meaningful plan that we call Punta Cana Safe Zone. This plan is currently being executed, integrating safety measures, public health, epidemiology concepts, all of that just to provide good sense of public health safety in the area. Can we go to the next? More on leveraging technologies, and these are my last few slides. Next. One of the things that we learned from Asia, Europe, the States, and Latin America is that one good way of deploying intelligently and effectively assets is by doing contact tracing. So we deployed this MIT-developed app called SafePath. Next, and we integrated SafePath, the SafePath code, within the our big app that's called COVID-DR, COVID-RD. COVID-RD integrates artificial intelligence, symptom management, a call center line, now with a contact tracing app that allows the user to understand if they have been exposed to a COVID positive patient and guide recommendations in terms of testing. This, in essence, what this creates is a technology solution that we have actually done with all the legal items and ethical items. This code is a MIT code. It has a lot of confidentiality elements. nobody, this never confides a name or any kind of identifier or anybody involved. It just creates a tool to properly assess potential contacts, and by doing so, it allows us to do proper interventions at the local level. And then the next stages will include a COVID number, QR code to allow access to different lines of services based on the safety that the contact tracing app has. Can we go to the next? So this is being launched this week. An MIT code with all the safety and confidentiality elements, but deployed in an intelligent way to help us achieve intelligent solutions to epidemiology assessment and interventions. Can we go to the next? So a lot of this, just in my mind, all these efforts need to make sense now and for the long run. So my goal is to have COVID develop and strengthen permanently the DR health system. And we have achieved that by creating an MP Fusion Center, strengthening emergency and critical care, strengthening primary care, like in the case example of telemedicine and home visits, laboratory medicine by enhancing laboratory capacity throughout the country. And this creates purpose. With purpose, you have hope. And with hope, that positivity emanates a different kind of energy that we need to actually overcome COVID, all serving a common good. And this is a lot of the results that I'm showcasing. It's not just us, is the collective efforts of all Dominicans, public, private, individuals, saying that surpassing and beating this virus was the common goal, was the common good. And right now we have achieved a lot of positive results based on common sacrifices of all the Dominicans. So I think right now we have an opportunity for question and answers.
Thank you, Dr. Baez, for a very interesting and robust presentation. We are indeed getting numerous questions about reopening dates, protocols that will be in place, and testing types and capacity. And our panelists will be answering them soon. But first, let's hear from another of our presenters. Let me introduce Ms. Maribel Rodríguez, Senior Vice President, Membership and Commercial, World Travel and Tourism Council. Ms. Rodríguez.
Hello, do you hear me properly?
Yes, we hear you just fine.
Yes, thank you very much. Very interesting presentation and well done. Well, I think it's here in Europe where we are based, our WTTC. We are in the middle of the desescalada, as you were mentioning before, going in the right direction, but we went through very hard times. And we saw this coming from China and we didn't look properly. And now what I want to mention is that we should learn from the past. We should learn from the experience. Let's use this opportunity now that we have had to make sure that we are not repeating that again, not making sure that we are controlling the pandemics, the crisis, the outbreaks, and how this can impact in our countries. We have been studying over the last years, almost 90 crises, how they impact in our sector, which is the travel and tourism. WTTC represents over 200 CEOs of travel and tourism companies worldwide. We represent them when we talk to governments, when we try to explain to them how important our sector is for the economy and for the employment. In the case of the Dominican Republic, above 16% of the GDP is because of travel and tourism, and more than 17% of the population is working in this beautiful sector. Of course, now highly impacted by what is happening, but we are going to learn from this. As I said, we have been studying many crises all over the world, and we have identified that we are very resilient as a sector. So more and more we are able to go out of the situations in shorter period of time. But what we have to learn is to use this as an example to know what we have to do and avoid having situations like, for example, in September 11, that suddenly when someone started to travel, again, they have to spend a lot of their time queuing at airports, and complicated the experience of the tourist. Right now, what we have to do when we, of course, start to relieve for the situation, and I totally agree with the doctor about the tracing and testing, test, is what we are recommending all over the world through the different governments. We have been speaking to above 150 governments worldwide and explain to them how important is this, making sure that we are understanding where those cases are, so in the future we can isolate the patients and we can continue our normal life and implement the sanity component into the value chain of travel and tourism experience. So learning from the past and to recover faster is what we said. For that, and I come back again to the words of Dr. Amado, it's very important the private and public collaboration, build from current seamless travel experience with the sanitary component, and embrace global standards and protocols. When we talk to the consumer and to the tourist, when they will start traveling again, they need to know exactly what they are going to be having or what they should be expecting, and to have a global cooperation, so they don't have to think, oh, if I go to China, this is the situation. If I go to a hotel, this is the situation. Or if I take a car, that is how we have to behave. We have to have the same global standards to embrace and to rebuild the trust of the traveler. And that is the reason why we need to embrace as well the technology, and to make sure that we are allowing contact tracing, testing, and coordinating with the sector standards for the industry. That is really, really important. So as well, what we are doing right now is creating a protocol for the hospitality, for airports, for airlines, for tour operators and travel agencies, and working very heavily with all our members for the future of travel and the traveler experience, to identify what are those this common field where we have to all agree, and to make sure that the traveler is understanding where they go. Because again, first is to make sure that there is a control, sanitary control, and first making sure that we are not going to go against the pandemic, and of course we are not going to advance the processes, but of course we need to make sure that when we are going back to normal, we need to have all those sort of implemented standards and protocols. That is really, really important, and such a place like Dominican Republic, where you depend massively in travel and tourism. That is really important. So I have some room for questions if you want later, but that is what I wanted to express from our organization. Well done. We expect that flattering the curve as you are doing now, and starting the 1st of July is going to be giving to you some breath and support. And what we are doing now in Europe, and we are now considering in other places of the world, is looking at the corridors. And again, going back to the slides of Dr. Amado, all those, these call it green zones, or places with the same facing, that are the ones that should be starting first. We're starting first domestic, then regional. Regional is the region where you are located. Now it's the Caribbean, or a little bit bigger, but it's the region for you in that case. And then international. That are going to be the phase. We know that it's not going to be, everybody is not going to be starting from 0 to 100. And that's why as well we have been advocating in behalf of our members to governments, for them to be able to do the right policies to support the private sector to be able to be there when the travelers are back and start going to the beautiful destinations again. So that's from me. Thank you very much. I'm ready for any questions. And again, well done to Dominican Republic and to the presentation that Dr. Amado just did. Thank you very much.
Thank you, Ms. Rodriguez. Thank you very much. We have just one more presenter before we go to the Q&A, but keep the questions coming. We will get to them. We will answer them. Let me introduce now Mr. José Solís Padilla, Senior Administrator for International Business Development at the Mayo Clinic. Thank you.
Thank you, and congratulations on the presentation. I think we are facing unprecedented times that bring a lot of anxiety and uncertainty, and basing everything that we do in science and data brings a whole new perspective of things that we didn't think before. I would like to share a little bit of some reflections that I've seen in the latest days. I feel that everybody in these presentations of my colleagues truly enlightened two things: that we cannot operate alone. We have to work and collaborate not only within our sector, but outside of our sector. I think that the future of competition is collaboration, and these times call us to do a better job and a more intentional job in that strengthening and that union of forces. Also, really tells us that we don't know everything. We need to continuously learn. And for the Mayo Clinic, for us, we envision a 2030 plan. And we thought that that plan was comprehensive, that was the best plan we could ever make. We took a year and a half of strategic planning, and this pandemic really put it to a test. The good thing is that the plan and things that we envisioned for 2030 were accelerated and needed to happen in 3 weeks. You have talked about technology, and just to touch a little bit on that, we used to do about 100 video visits per week. We are doing thousands per week, and that didn't happen by chance. I think all the health systems in the nation and around the world are going through that transition. Like you, we also were sharing our resources and our knowledge, and we are collaborating with the public, private sector, with authorities, and we have put a lot of resources on the web that really talk about safety and new and best practices. We are leading some national efforts. I think crises bring good opportunities and challenges. So we are collaborating with a lot of sectors. And as you probably have heard in the news, we are leading efforts in terms of research. We are the leading institution nationally and internationally to find a cure for this disease. We are also looking into some vaccines and new ways to understand this disease. A lot of scientific collaboration across sectors. We are not only collaborating with the public health authorities or with academic medical centers. Technology has come and played a tremendous role in this. We also launch a lot of new products, services, and innovation. Just to give you a perspective, in these enduring times that have put our organization to a test, we also accelerated innovation. There were 200 new patents submitted, and we are in the process of commercializing 66 new products that will help alleviate some of the new challenges that this disease brings. Like all of us, we continue to understand what is the new reality, what is it that we need to learn to live with, and of course, we continue to look forward to collaborate and to continue learning and sharing. And we are optimistic about the future. We know that as a human race, we are resilient because we can adapt to change. And we expect a lot of colleagues, a lot of things to join efforts and to continue moving forward. Thank you.
Thank you very much, Mr. Solís Padilla. Thank you very much. Very interesting to hear what the Mayo Clinic is doing these days. Okay, so the Q&A is here. We received more than 50 questions, so some of them our production team is working right now to answer them on the chat. But we're going to go to a couple of questions first for Dr. Baez. The first one, Dr. Baez, would be, are we facing a gradual reopening of the tourism sector, or all touristic areas are going to open at the same time in the Dominican Republic? And if that is the case, what is the date of reopening?
All right, so the official date for airports is July 1st. Without extending my reach, I can safely say that the general approach in the Dominican is to create national policies. So not do it territorial, but then allow local efforts to polish subsequent moves. So likely July 1st is going to be that opening. And then the strengthening of that opening or tightening public health interventions is going to be dependent on local behaviors.
Okay, thank you very much. The second question for you, Dr. Baez, is about tests. And are you performing rapid tests or PCRs?
Yeah, so we're doing both. And I actually saw one of the questions that talked about duplication of numbers, and I want to talk a little bit about that. So the reported numbers that we have produced tens of thousands of PCR tests. When we reported today, 2,500, those were all PCRs. And PCR is done by integrating public and private labs. Now we have a PCR point of care system that's being deployed called Gene Expert. And that's being deployed, 20 new machines deployed by the National Health Service. And we also have tens of thousands of rapid tests. They actually don't show up on the general data, but show up in our granular assessment. So I actually have a dashboard of rapid IgG and IgM tests, but the Ministry of Health doesn't report those because we prefer reporting the validity of PCR. If you allow me, I actually saw that question on duplicating the number of positives, and I should clarify that when you see, and I tried to clarify that a little bit, if we perform 2,000 tests and we get 500 positive, that is the same relative number as if we performed 1,000 tests and achieved 250. So the increasing number of positive tests is a result of increasing the number of PCR tests that we're doing. The absolute numbers are always going to look more if we increase the number of tests, but the relative percentage has been stable and decreasing steady in some places.
Okay, thank you for clarifying that Dr. Baez. We're going to the third question. Some of the members of Asonahores, if you can take this one. It's about hotels and excursions protocols for guests. What are those?
Could you repeat the question?
Yes, of course. Yes. Yes, Paola, of course. Our audience is asking about hotel and excursions protocols, COVID-19 protocols. When we reopen, what protocols are going to be in place?
Well, there's protocols that are over 200 pages long for some hotels. I can tell you that the official protocols haven't yet been published, so we can't really talk about them yet because they're not official yet. We worked on them, we've been working for them for a while. We gave them to the government almost 4 weeks ago. The Ministry of Health, the Ministry of Tourism saw them, and now the special commission created to fight COVID in the Dominican Republic has it. And I was hoping that they would have them by today. I actually asked them for it because I knew it would be very positive for this webinar, and it was a chance, well, to let everyone know what they were. But unfortunately, they won't be official till the end of this week. Maybe tomorrow or by Friday, the tops.
Okay, thank you very much.
I'm sorry, if I may add, because while the webinar has been progressing, I've actually received some information on the protocols that I think is very, very important to add to what Paola has indicated. In fact, the protocols were delivered to the Ministry of Tourism today, and they're being placed on their website. And what is most important is that there will be a process whereby the Ministry of Tourism will begin individual webinars to discuss these protocols in detail with the various professionals that would be particularly interested. Because there are hotel protocols, airport protocols, airline protocols, tours protocols, etc. Those are all meant and they're all shall we say, meant for a July 1st reopening. So again, we should be looking at a full reopening of the country by July 1st.
Thank you so much, Simon. Thank you.
Pleasure.
And the last question that we're taking on the floor today is about economic estimates of COVID-19 on the tourism sector. What have been the effects of economic effects on the sector of COVID-19? Simon Suarez, if you would like to take this question.
I can take it, Simon.
Sure.
Let me finish by saying that, adding to what Simon was saying before about the protocols, Asonahores and MITUR, which is the Ministry of Tourism, and the government has been working so we can get WTTC's or be part of WTTC's protocols too. So we want to make sure that we comply with them as part of the whole thing, to make sure that is, as they said before, one protocol that abides for all. So you know what to expect when you get to each country, to each hotel, to each airport. It's the way it should be, and Asonahores believes in that, and that's why we want to apply with that. We have also been working with MayoClinic, with Dr. Solís, because we also want to make sure that the protocols are the right ones for the United States. We want to be validated, basically. The Dominican Republic wants to be validated, so we can, so anyone that comes to the Dominican Republic knows that it's a safe place to come to, and that we have the right protocols for them to work. In regards to the economic impact, Alejandra, well, as you know, this country depends very much on tourism, and as WTTC said before, about 16% of our BNP is, and 12 or 13, 14% of our labor force works for tourism. So it definitely has been a huge impact. We have been closed since middle of March. We had a bad year in the 2019, or not a great year. We had a beginning of a great year and then didn't end as well. We were beginning to recuperate this year, and well, by March we were closing down. So it is what the economists have said, because I am not one, is that it's already hit 7.2% of the BNP. It's down 10.2% just because of tourism. So, I mean, tourism has a great impact on the economy, but we believe that we have been very resilient all throughout the years. Tourism is a very global industry, so we can adapt, we can change, we can make the arrangements, the adjustments very fast. And we've done this in the past with hurricanes, with other types of problems, with the mediatic problems that we had last year. And we come through, we adapt and make sure to reinvent ourselves in a new way and come back stronger than we were before. And of course, this seminar is meant to make sure that everyone knows that the safeguard of our visitors is the first and foremost, most important thing for us in the tourism industry, and that we are taking all the necessary measures to assure that.
Thank you very much, Paola. Okay, if there's nothing else from our panelists, we've reached the end of this webinar. We hope you enjoyed it and it was informative. Again, let me extend the warmest regard from the Ministry of the Tourism of the Dominican Republic, MITUR, and from Asonahores, the Association of Hotels and Tourism. Thank you very much for participating, and see you soon.